sweet like a buttercup. You're a Barbie doll. Show them all what I'm made of. Strut down the hall. Won't stop till I get enough.
All right, so get this. A recent tuberculosis outbreak.
Whoa, wow.
Right here in the U.S., in Kansas.
Here.
Yeah, and we're looking at a Time article from January 29th, 2025.
Okay.
And it's got even the experts kind of scratching their heads.
Yeah, it definitely is a situation that challenges some assumptions about TB.
Right. Yeah.
Especially in a country like the U.S. where we often think of it as like a disease of the past.
Exactly. And it's not just a few cases either.
Right.
It's 67 people with active TB in Wyandotte County.
Wow.
As of January 24th.
Yeah.
So that's alarming.
Yes.
What's interesting is this wasn't really on anyone's radar.
Mm.
Why were health officials blindsided in this case?
Well, before we jump into the specifics of the Kansas outbreak,
Okay.
it might be helpful to just refresh our understanding of tuberculosis in general.
Okay.
Remember, TB is caused by bacteria
Right.
that primarily affect the lungs,
Mhm.
and it spreads through the air, kind of like the common cold.
Right.
But here's the thing.
Okay.
There's a big difference between having latent TB and active TB.
Right. I remember reading about that.
Yeah.
Latent TB is like having these little bacterial ninjas hiding out in your system, but they're not causing any trouble yet.
That's a pretty good analogy.
Thanks.
Someone with latent TB has the bacteria in their body,
Okay.
but it's inactive. They don't have symptoms and they can't spread it to others.
Gotcha.
But here's the kicker.
Okay.
A quarter of the entire world population
Wow.
is estimated to have latent TB.
A quarter of the world.
Yeah.
So basically millions of people walking around with this potential time bomb
Right.
in their lungs.
Yeah.
That's wild.
Yeah.
But this Kansas outbreak involves people with active TB,
Right?
right?
Exactly.
So how does latent TB become active?
Right.
And why are we seeing this spike in cases now?
Well, there are a number of factors that can contribute to latent TB becoming active. Things like a weakened immune system,
Okay.
HIV infection, malnutrition, or even just aging can increase the risk.
Gotcha.
And in terms of why we're seeing a spike in cases, that's a complex question with no easy answer.
Well, the Time article mentioned that this Kansas outbreak isn't even the largest in U.S. history.
Right.
They pointed to a couple of bigger outbreaks.
Yes.
Including one in Georgia that spread through homeless shelters.
Yes. That outbreak in Georgia between 2015 and 2017
Okay.
resulted in over 170 active TB cases
Wow.
and more than 400 latent cases.
That's a lot.
Yeah, it really highlighted how social and environmental factors can contribute to the spread of TB.
It's a grim reminder of how vulnerable certain communities are.
Definitely.
But you mentioned contaminated tissue, too.
Yeah.
That's less about overcrowding, right?
That's right.
What's the story there?
So that's the one that spread nationwide in 2021,
Okay.
and it was linked to contaminated tissue used in bone transplants.
Hold on, contaminated tissue.
Yeah.
How does that even happen?
It's a bit of a medical mystery,
Okay.
but it affected 113 patients across the country.
Wow.
It really underscores the importance of rigorous safety protocols in healthcare settings and in tissue donation procedures.
Yeah, for sure.
This case in particular involved a strain resistant to common antibiotics.
Oh, no.
Yeah, it's called multi-drug resistant TB or MDR TB.
So not only are we seeing more TB cases overall, but we're also seeing more cases of this tougher to treat kind.
Exactly.
That's concerning.
It is.
Well, let's get back to Kansas.
Okay.
Is there any indication that MDR TB is involved in this outbreak? And what exactly is making experts so worried?
Well, the Time article doesn't explicitly mention MDR TB in relation to the Kansas cases,
Okay.
but it does quote Dr. Dana Hawkinson, an infectious disease doctor,
Okay.
who called the high case counts a stark warning.
A stark warning.
Yeah.
That sounds ominous.
Yeah.
What do you think he means by that?
Well,
Is there something about this particular outbreak that's especially concerning?
it could be a combination of factors.
Yeah.
While 67 cases might not seem like a huge number compared to some historical outbreaks, what's unusual here is that it's happening in a place where TB cases are typically very low. They were expecting maybe a handful of cases per year,
Yeah.
not a sudden spike like this.
So it's the unexpected nature of the outbreak.
Yes.
The fact that it seemingly came out of nowhere.
Yeah,
That's raising red flags.
exactly. It raises questions about whether there are underlying factors we're not aware of.
Okay.
Perhaps changes in demographics, social conditions,
Yeah.
or even access to health care
Right.
that could be contributing to this resurgence.
And we're not just talking about Kansas here.
Right.
The article mentioned that TB is on the rise globally.
Yes, it is.
It's almost like this Kansas outbreak is a microcosm of a much larger problem.
Right.
The article mentioned that in 2023,
Yeah.
there were 1.25 million deaths from TB
Wow.
and 8 million new infections worldwide.
That's a lot.
The highest numbers since the World Health Organization started tracking.
Yeah, it's really,
So those are some pretty sobering statistics.
it is a stark reminder that TB is far from a vanquished disease.
Yeah.
It's still a major global health threat, particularly in low and middle income countries.
Right.
But this resurgence in some higher income areas
Yeah.
is definitely cause for concern.
So what's driving this global rise in TB cases? Is it just poverty and lack of access to healthcare?
It's a complex interplay of factors,
All right.
but poverty definitely plays a significant role.
Right.
Overcrowded living conditions,
Yeah.
malnutrition, and weakened immune systems due to other health issues can all make people more susceptible to TB.
It's almost like a vicious cycle, isn't it?
Yeah.
Poverty creates the conditions that make TB more likely to spread.
Right.
And then TB further exacerbates those conditions by making people sick and unable to work.
Exactly.
It's heartbreaking.
It is.
But what about here in the U.S.?
Right.
We don't have the same level of poverty as some other countries. So why are we seeing this uptick in cases?
Well, even in a country like the U.S. Okay.
We have pockets of poverty and inequality where TB can gain a foothold.
Right.
Homelessness, for example,
Yeah.
is a major risk factor, as we saw with that outbreak in Georgia.
Right.
And then there are issues like access to health care,
Okay.
immigration patterns, and even the stigma associated with TB that can all play a role.
The stigma.
Yeah.
What do you mean by that?
Well, TB has historically been associated with poverty and marginalized communities,
Right.
and that can lead to shame and reluctance to seek help.
Oh.
Some people may be afraid to get tested or disclose their diagnosis for fear of discrimination or social isolation.
That's really sad.
Yeah,
It's almost like the stigma itself becomes another barrier to treatment and prevention.
it definitely can.
But getting back to this Kansas outbreak,
Okay.
I keep coming back to Dr. Hawkinson's stark warning.
Hmm.
What do you think is most concerning to experts about this particular situation?
I think one concern is that this outbreak might be a sign of things to come.
If TB is starting to make a comeback in a place like Kansas,
Yeah.
it could be a harbinger of a broader resurgence in the U.S.
Right.
And remember, we're not just talking about ordinary TB here.
Right.
The contaminated tissue case you mentioned earlier
Yeah.
involved a strain resistant to multiple drugs.
Right. That MDR-TB.
Exactly.
You said it requires longer and more expensive treatment.
Yeah.
And it's even deadlier.
That's right.
Is there a risk that this Kansas outbreak could involve MDR-TB as well?
The article didn't specifically mention MDR-TB in relation to Kansas,
Okay.
but it's definitely something health officials will be monitoring closely.
Okay.
They'll be doing contact tracing and genetic testing to understand the strain involved and assess any potential drug resistance.
So there's a chance that this outbreak could be even more serious than it already seems.
It's a possibility, and it underscores the importance of early detection, rapid treatment, and robust public health measures to contain the spread.
So what can be done? How do we stop TB from gaining a foothold in the U.S. and globally?
It requires a multi-pronged approach.
Okay.
On a global level, we need to address the underlying social and economic factors that contribute to TB vulnerability. That means investing in poverty reduction,
Right.
improving living conditions, and ensuring access to quality health care for everyone.
It sounds like a massive undertaking.
It is, but it's essential.
Right.
And here in the U.S.,
Yeah?
we need to strengthen our public health infrastructure,
Okay.
improve TB surveillance and testing, and raise awareness about the disease and its risks.
Speaking of awareness,
Yeah.
I have to admit, before diving into this article with you, I hadn't really thought about TB in years.
Right.
I felt like something out of a history book.
It's easy to forget about diseases that aren't on our immediate radar.
Yeah.
But this Kansas outbreak is a reminder that TB is still a very real threat, and we can't afford to be complacent.
Absolutely. So we've talked about the Kansas outbreak,
Right.
the global trends, the social and economic factors, and the potential dangers of MDR-TB.
Yes.
It's been a whirlwind of information.
Definitely.
Before we wrap things up, let's do a quick recap of the key takeaways.
A good place to start is remembering that latent TB is incredibly common.
Right.
We said that 1/4 of the world has it.
It really makes you think how many people are walking around with it and they don't even know.
That's right. That's why testing is so important, especially for those who may have been exposed to the disease
Right.
or who have risk factors like weakened immune systems. Early detection and treatment of latent TB can prevent it from becoming active and spreading to others.
Okay, so that's point number one.
Right.
Latent TB is widespread, and testing is crucial.
Yes.
What else should we be taking away from this deep dive?
Well, we've also seen how TB outbreaks can occur in really unexpected ways.
Yeah.
As illustrated by that contaminated tissue case.
Right.
It highlights the interconnectedness of our world and the potential for transmission routes we might not even anticipate.
Right. It's a reminder that we can't become complacent about safety protocols and public health measures.
Definitely not.
And, of course, we need to be aware of the alarming global trend.
Yes.
TB cases are on the rise.
Right.
And this Kansas outbreak adds to that concern.
It does.
It makes us ask some tough questions.
Yeah.
About what might be contributing to this resurgence, both locally and globally.
For sure.
It's definitely given me a new perspective on TB.
Uh-huh.
I think I went into this thinking of it as a disease of the past.
Right.
But it's clearly a very real threat in the present and potentially even more so in the future.
Absolutely.
What are some of the factors that worry you the most?
Well, one concern is the rise of drug-resistant TB, like we discussed earlier.
Yeah.
MDR-TB is much harder and more expensive to treat, and it poses a significant challenge to global TB control efforts.
Right.
The potential for this Kansas outbreak to involve MDR-TB is definitely something that needs to be monitored very closely.
And we can't forget about the social and economic factors.
Yeah, right.
That contribute to TB vulnerability.
Exactly.
Poverty, homelessness, lack of access to health care.
Yeah.
These are all issues that need to be addressed if we want to make real progress in fighting this disease.
Absolutely. Public health is about more than just treating individual cases. It's about creating a society where everyone has the opportunity to be healthy.
Well said. So what can we as individuals do to help? It's easy to feel overwhelmed by the scale of the problem.
You're right. But even individual actions can make a difference.
Okay.
Supporting organizations that are working to fight TB globally, advocating for policies that address poverty and health disparities, even just staying informed about the issue.
Yeah.
These are all things we can do. And on a personal level, taking steps to protect ourselves and others, like getting tested if we're at risk, staying home when we're sick, and just practicing good hygiene, these things matter.
It's a reminder that public health is everyone's responsibility. This has been a truly insightful deep dive.
Glad to hear it.
I feel like I've learned so much.
Oh, good.
And I definitely have a newfound appreciation for the complexity of TB and the challenges we face in controlling it.
Yeah.
Any final thoughts before we wrap up?
I think it's important to remember that while the situation is serious, it's not hopeless.
Right.
There has been tremendous progress in TB research and treatment over the years. With continued commitment and collaboration, we can make a difference.
Well, on that note of cautious optimism, I think we'll wrap up this deep dive.
Sounds good.
Huge thank you to you for sharing your expertise with us.
It was my pleasure.
And to you listening, thanks for joining us on this journey into the world of TB. We'll see you next time for another fascinating exploration of the world around us. Stay curious and stay healthy.
Sound the alarm. I'm coming up. We'll have a ball. I'm sweet like a buttercup. You're a Barbie doll. Show them all what I'm made of. Strut down the hall.